So, good morning, Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. We're almost a year into COVID now. It was the first cases in Washington State, I think, and then in California soon afterwards. We're in February of last year, and so we're getting close to that mark, which means that we're, I think, probably well over halfway into this, my opinion. But just a little bit of nostalgia. Remember cruise ships and the cruise ship outbreaks? Haven't seen any cruise ship outbreaks for quite some time now because cruise ships aren't sailing. But if you remember how all this started with the introduction of the virus initially from China into the Seattle area in Washington State, and then simultaneously into California through some cruise ship introductions. And then not long after that, New York, and that virus came from Italy, I think, and the rest is somewhat history. So how is COVID looking like in the country right now? As we've been saying, Los Angeles, Southern California, Western Arizona, and a couple other states in the Midwest that had been wrestling with it. Counts are starting to come down a little bit in those areas, and which is good news for them because they've been really hit hard with case rates well over 100 per 100,000. Here in the world, Europe is still coming down slowly after their wave peak in December. And England looks like is coming down slowly also, but they're real serious about their lockdowns in England right now. And to show you how serious is that you're allowed one 30-minute exercise period outside per day, and you can only see one other person during that time frame, and you have to stay masked and distanced. And so they're very worried about their variant there. Just a little bit about the variant. So we are starting to see a few more cases of that here in the United States as we look for it more. And there's really not a lot of news since we talked about it last week. Still up in the air how much more transmissible it really is. And probably some. But exactly how much we're still working out. And it still looks like that it isn't any more severe than regular COVID. And the best news is that the more and more we study it, the vaccine does seem to cover it just as well as it does regular old COVID. So here in North Carolina, we haven't seen any of the variant. It could be here. We just have to start looking harder for it. And then, so how are our cases in North Carolina going? Over the state, up, yet not up as fast as it went up in early December following Thanksgiving, but it is going up. Here in Forsyth County, as of yesterday, our rate was about 72, 74 or so per 100,000, which actually is the same as what it was in the first week of December. Our total case numbers in Forsyth County are about the same they were in the first week of December. Our percent positive is up a little bit from the first week of December. Some of that may be because we're not doing large swaths of asymptomatic testing for surgery now. So there's more symptomatic people within that group, which will drive the rate up. So I guess the good news is we're not really exploding over the last month and a half, but the rates are high and higher than I'd like to see them, that's for sure. The counties around us are still higher than us, and a lot of the counties to the west and immediate south of us are still over 100 per 100,000. And And so they're proportionately, they're seeing more COVID. Our hospitals, how are our hospitals doing? Well, we're still busy. We're always busy in January. And we're busy right now. It's not all just COVID, but all sorts of things, and infections, and non-infections, and trauma, and all the usual stuff that we see. People always ask me, what's your capacity? Are you at capacity? Well, as I say every week, capacity is how you set it, and we take care of what we need to take care of, and we do it safely. And if we need a little bit more room to take care of COVID, then we do a little bit less joint surgeries or things that can be put off a month and a half or 2 months without any problems. We are still doing the surgeries that need to be done, cancer surgeries, emergency surgeries. No one's hurting for needing to get medical care. They can get it, and they can get it safely. So that's good. Hats off to all the health systems in the triad for being flexible and adaptive to take care of people who are sick, and that's what hospitals do. What else is going on in the communities? Vaccines is trying to keep up with the vaccination guidelines and numbers is hard for me. So I can imagine it's really hard for everyone else out there. I can sum it up by saying because we still have the same two vaccines, Pfizer's and Moderna's. The manufacturing of it isn't quite as fast as we thought it was going to be. Vaccine supply isn't quite as robust as we thought it would be at this time. And so there's a lot of discussion going on at the national level about vaccine distribution and how to improve it. And not only do we need more vaccine, but we need more efficient ways of giving vaccine and getting the vaccine to people. We're all working on that. I can tell you that the number of people getting vaccinated per day in North Carolina and in the Triad every day is going up. And so it's going the right way. Almost everyone that I know who has vaccine is keeping up with the supply that we're getting from the state and getting it into people. I've pointed out before, logistically, it's a little bit hard to do this vaccine because of the requirements to keep it frozen. Once it's thawed, it has to be used. We have to count our doses pretty carefully. The worst vaccine dose in the world is one that has to be wasted because it didn't go into a person's arm. So we haven't had any wasted doses that I know of yet in Forsyth County. So that's good. We're keeping track. It also means that because of the complexities of giving the vaccine, that unlike flu, it's harder to give it in a doctor's office. Because if you think about how your physician's office works, there's usually one nurse that comes in with the doc that covers 3 or 4 other docs, and then she gives you your flu shot afterwards or your tetanus shot or whatever shot you need. So for the COVID vaccine, you need representatives from pharmacy, you need data entry people to get people registered with the state and then to upload the vaccine info afterwards. You need people to draw up the vaccine, you need people to give the vaccine, and then people have to be monitored in a socially distanced way for 15 minutes afterwards. And so it takes more people to do it, and most doctors' offices just don't have that, or they don't have the room. Because think about it, if you've got 10 people who've just gotten vaccinated and they're all socially distanced 6 feet apart, that you need in a linear way 60 feet of space, right? And a lot of doctors' offices just don't have that. So what people are going to see as vaccine rolls out for the general public is that clinics will get together, and the larger clinic that have the areas to do it then will pool patients from several other offices, and they'll be doing it there. And that's starting to happen actually now in Forsyth County for the general public. Both Novant and us at Wake Forest Baptist Health are starting to immunize people. Right now it's people over the age of 75, which is the prioritization group that we have as of today. And so that's getting ramped up, and more people are getting vaccinated every day. There's still a backlog, and I know, for instance, at Forsyth County Health Department, as with a lot of health departments across the country, that they get their appointments ramped up and they give the vaccine that they have, and then they have to take a break for 2 or 3 days until the next batch of vaccine comes in from the state. And that right now, for instance, at Forsyth County, they're not taking new appointments because they're still working through the people who were given appointments or slots before. So hopefully they'll be taking appointments again soon. So my recommendations for anyone in any health system is if you're in a priority group and you get a slot to get a vaccine, and it could even be in another county because people can cross county lines, I'd just take it and get your shot there. If you get your first shot, for instance, at the health department, then you'll need to get your second shot there. If you get your first shot at Novant, you'll need to get your second shot there. If you get your first shot at Wake Forest, you need to get your second shot there. So that's just one stipulation about where you go. So you might want to keep that in mind. Something that's going to be helping out in our region, as well as in some other regions in North Carolina, are large mass vaccination events. What's a mass vaccination event? Is when everyone pools their resources and gets together and vaccinates large number of people in areas that can handle large numbers of people. So things like speedways, stadiums, a large fairground building. So here in North Carolina, maybe the education building out at the fairgrounds. Because you have parking, a lot of these places are on bus routes. People can get transportation there. They're often centrally located. And importantly, they should be close to people who are from traditionally marginalized populations that have difficulty with access to health care. So they can get vaccinated too. So those are in the works, and those are being planned, and including up here in the Triad. People should be watching out for one coming up in the first part of February up here. And I think that'll be with partnerships between the health department, healthcare systems, and would like for it to be regional as well, which means the counties around us, because we want to make sure that our colleagues and friends and citizens that are in the rural areas around the urban areas get taken care of too. It's important. So look for that coming up. Priority groups with vaccination has been complicated and a moving target. So if you know, we started out with healthcare workers and people in nursing homes and staff in nursing homes. And then when we moved up, a week ago, I guess, it seems like ages ago, to the over 75 population. And then at the federal level, they would like to see us starting to immunize everyone over the age of 65 and anyone with any kind of chronic medical conditions. And that they would like us to start soon. So that sounds great. From as far as I'm concerned, the more people who get vaccinated, the better. The best vaccine is a vaccine in somebody's arm. The problem is that that group over the age of 65 and then people with medical problems constitute, probably somewhere across the country, 150 to 175 million people. And we have about 30 million doses of vaccine. So there's going to be a lot of people who won't be able to get it. for a while. So people are going to have to be patient. Just saying that, okay, it's okay for you to get vaccinated, doesn't mean there's a vaccine out there for you. And so, we'll have to see how that rolls out. Appointments are going to be scarce for a while, and people are going to have to be patient. I think that calling around and asking calling your doctor and asking them, hey, doc, when are you going to get your vaccine in? Remember what I said, that primary care offices, at least right now, won't be doing this unless they're affiliated or have partnered with other places. And so we'll try to keep up and let everyone know the vaccine sites that are available to people. You can go to the health system web pages, either for us at Wake Forest Baptist Health or Novant, the health department. And right now, those are the only vaccine providers here in the county. And I think that as time goes on, the number of vaccine providers will ramp up, and so you may see some workplace-related vaccination events, such as Wake Forest University, Winston-Salem State, Reynolds America, large corporations and such that have occupational health resources available to them. So as time goes on, there'll be more and more places to get it. As time goes on, there'll be more vaccine available. So as time goes on, your odds of finding an appointment are going to go up. But we just have to be patient. So what vaccine? By the way, people keep asking. The most common, Dr. Ohl, what question are you getting asked the most? And people want to know. So how you doing after your shot? And I'm doing great, actually. I was a little sore 2 days afterwards. But as I tell people, if I knew how to play tennis, I think I could have. But it went real well. The vaccines that are out there now, Pfizer's and Moderna's, both messenger RNA vaccines, we still get really good data that they're very effective, 95%. And they're safe. We've had a few allergic reactions occur that are called anaphylaxis, which is a serious allergy where you need epinephrine shot. People who have bee sting allergies and have to carry an EpiPen, they know what that's all about. But so far, it looks like the rate is somewhere between about 10 people per million vaccinated. Flu shots, anaphylaxis rate's about 2 per million, so it's a little bit higher than a flu shot, but still really rare. And we haven't had any in the county that I know of, actually. Who is more at risk of those is if you've had an anaphylactic reaction to a vaccine or an injectable in the past, then that's something you're going to want to tell people at the vaccine clinic. People who have shellfish allergies, bee allergies, certain food allergies that you have to carry an EpiPen for, let your vaccinator know that. Bring your EpiPen with you, even though we have them at the vaccine sites. And that increases your risk a tiny bit, but the benefit of the vaccine outweighs that risk by far. So you should still get vaccinated. And any of the other allergies, like I get hay fever in the fall, or when the trees bloom, my eyes water, that's not a problem at all. Just get vaccinated. So still extremely encouraged, safe and effective. Are there new vaccines on the launching pad? Yes, there are. In fact, maybe sometime in the next month, there'll be another vaccine that's put to the FDA and analyzed. This is a vaccine that would be one shot. It doesn't have the complex freezer requirements, and it's a protein shot. It's not a live virus vaccine. And we'll see. The problem with that one is that manufacturing of it's slow. It takes a long time for them to make it. And then maybe one coming out sometimes towards March, the AstraZeneca vaccine, which people have heard about. maybe down then. So that'll be helpful to us when those come out. Let's see, I'm seeing if I've got all my notes covered here. Let's go on and take questions, since I think a lot of this will come up. We asked for people to submit questions. Most of the questions that were given to us were about either the variant or vaccines, and we talked about the variant some. So I'll just go down the list. Jan would like to know, is there an issue taking other vaccines, Shingrix or Pneumovax or tetanus or all those other shots that we get from time to time around the time of COVID vaccines? How much time is needed between injections? About 4 weeks is what we ask people. If for some reason it happens earlier than that, it's not a problem. It's not a safety problem. But that's sort of a rule we use for a lot of different vaccines, that you either get them at the same time or you get them about 4 weeks apart. So that's an easy one to answer. Some of my family members have a blood clotting disorder. Should that be a concern for getting the vaccine? Only if that blood clotting disorder has been a problem for you getting other injections into muscles in the past. That would be something you want to tell the people at the vaccine clinic about. The number of people who have that is pretty low, actually. Most people can take shots in the muscles, even if they have a blood clotting disorder. But you want to talk to your doctor about that afterwards. Certainly that for a lot of people who are on blood thinners, and there are a lot of people on blood thinners out there, if you're on a blood thinner, you can still get the vaccine. It's not a problem. Have vaccines been tested on people with autoimmune diseases? Yes, there were autoimmune disorders included in the clinical trials. And so there have been people who have autoimmune diseases who've gotten it. Having an autoimmune disease actually is a reason to want to get the vaccine, because your risk of having more problems with COVID is higher if you should get COVID. So if you have an autoimmune disorder like lupus or something like that, you should still get vaccinated. Melinda asks, I am concerned there will be a shortage when we go to the booster shot. How can we be guaranteed we get the second shot in a timely manner? That's a good question. And that enters in a little bit on the debate that's going on right now in the country. So the federal government's been holding back half of the vaccine that's available. And that's to make sure people who need the second shot can get it. There are experts on both sides saying that that we should not be holding back those for the second dose. We should just get as many people the first dose now as possible, and then we will just they think that manufacturing will be able to step up and come through to give us to get enough second doses when they come up. And so why would we want to do that? Well, I mean, there's a lot of people getting COVID. We're having a lot of deaths. We want to protect as many as people as possible. One dose is about 85% effective, somewhere in there. And so those people say, well, that would be an advantage. We'll save more lives if we get more people vaccinated quicker. The other side, though, says, well, the clinical trials were done with 2 doses, and 2 doses that are spaced 21 or 28 days apart, or roughly in that time frame, is better than 1 dose. And that is also true. If you do the 2 doses, you get up to 95%. And so that group says, well, we should give the second dose because we want the best protection possible for those who get it. And we also don't know exactly how long the protection will last if you only get 1 dose, and the studies didn't look at that. So that's the debate going on. Right now, I think that there are more people on the side of let's just get the vaccine out there. If we do that, then we'll have this all of a sudden a kind of a one floodgate open and a bunch of vaccine come out, are we going to be able to get that into people quickly? Because remember, I told you how hard the logistics were to do it. And so there's kind of a little bit of a plus minus on that. So back to your question, how can we guarantee you'll get the second dose in a timely manner? I can tell you right now, you will get it. And you'll get a reminder from the state that it's due. Most vaccine sites have a reminder that comes out. There's an app you can put on your phone to tell the world how you're doing after the vaccine shot, what side effects you might be having. Oh, my arm's a little sore. You put a 2+ in there, but it also gives you reminders of when your next shot is due. Right now, you'll get your second shot. As time goes on, we'll just have to see what the federal directives are and whether the manufacturing keep up. And I will say, I probably wouldn't lose a lot of sleep over that because, first of all, if it's just a week or two, that's not an issue. If you're delaying the vaccine, so if you're supposed to get it on day 21 and you get it on day 30, it's going to work just as well, if maybe even a tiny bit better. If you get it 2 weeks afterwards, we have data that shows that it's going to work just as well. If we get out to like 3 months or so, like England has done with delaying their second dose, we don't know. The trial's not done. So, the official ACIP recommendations is that if your second dose is delayed, just go ahead and get it, and you don't have to restart the series. And knowing what I know about immunology is, I'm pretty sure that'll be okay. But again, I would feel a little bit better if we had a trial that looked at that. If someone has had COVID and had both doses of the vaccine, I understand they have protection, but can individual still carry or spread the virus? We don't know yet the answer to that question. And by the way, Janine asked that. We don't know yet. So it's a good question. There are some viruses that even if you've been vaccinated or had the disease in the past, you can transiently carry around the virus, mostly in the back of your throat or nose. And it is possible you could give it to another person. I think it's going to be less likely than if you've been vaccinated because there won't be as much virus to transiently carry. And most likely you won't get sick from it, so you won't even know it's there. But we'll have to see what that carriage is. And that's the reason we're still going to be wearing masks, even after you've been vaccinated, because we don't want you picking up and transiently carrying a virus around. And we want to make sure that if that does happen, that you are transiently carrying it, you won't give it to somebody else, which is possible. So we'll have to see. With time, we'll know. I'd say in another 3 or 4 months, we'll have good information on that. I'm hoping transient carriage is not common. And for most viruses, it's not a huge problem, but possible. Tracy asked, is there any protection after the first dose of vaccine? If so, how much? So I think I answered that. About 85% maybe, 2 to 3 weeks afterwards. You start to get protected right around day 12 is when it happens, and the curves go up. So if you happen to be exposed before you hit day 12, there's still a pretty good chance you're going to get COVID. That exposure risk, by the way, is 15 minutes at 6 feet, and unmasked is about 15% or so chance you'll get it from that one 15-minute exposure. So if you double that, you double in your chance. So if you do it before day 12 after getting the shot, you'll probably still get COVID. Is that going to mean, what does that mean? Well, it doesn't really mean much. You're still going to get protection from the shot, and you'll get some protection from having COVID, right? You'll develop immunity. It's kind of almost like getting your second shot. But you'll still want to get a second shot afterwards at the usual time frame. So it's just bad luck. So after you get your shot, make sure you're still distancing, make sure you're still wearing your mask, avoid bubble fusions, and you should be fine. What percentage of vaccination and COVID infections will it take to reach herd immunity? Right now, Tony Fauci is saying between 80 and 85%. And that's probably somewhere in the right ballpark. But you know, it's not a phenomena like turning on and off your TV. Okay, so it's not like you're perking along and you have lots and lots and lots of problems, and all of a sudden you hit 85% and it just totally goes away. That's not how it happens. It'll be that you start pushing it down, and it gets slower and slower and slower, the transmission rates. And then right around 85%, it's enough so that that ongoing transmission's not occurring, and you consider it taken care of. So, but we don't totally 100% know for sure because we haven't gotten there yet. So we'll know when we get there, I guess. Christy says, my elderly parents have remained at home since March except for doctor appointments and curbside pickups. Once they've completed the second dose of the vaccine, what is your recommendation about them cautiously returning into public areas, masked and socially distanced? That's a good question. So once you've had 2 doses of vaccine, your odds of getting COVID are much less, right? 95% protective. So if you're, and the trials had a fair number of elderly people in them, and it looked like the vaccine was also very protective in that group. Not quite as much as the 30-year-old healthy people, but still upwards in the 90s. So so that's good. The question is how much do you want to trust that and believe that the vaccine's got your back, as it were? So 90 to 95% protective is not 100%, so there's still a small chance you could get COVID. If you do, you'll probably not get as sick as you would have had you not have been vaccinated. In fact, we know that, particularly from Moderna's trial, that there weren't any severe cases of COVID in that trial. So you won't get quite nearly as sick, so that's good. You're still going to stay masked and socially distanced because we need to do that anyway until we know about transmission to other people. And if they were my elderly parents, I would probably still have them be very cautious, as you suggest they would be, and stay masked, socially distanced. If they called you up and say, hey, Kay, is it okay if I go to the Dirty Dancing contest down at Lake Lure? I'd probably say no. That's probably not a good idea. But if they want to come over and spend time with you and your family and visit a grandchild, I think it would be safe for them to do that, yes. My mom got the first shot of the vaccine, asked Kristen. She tested positive for COVID 2 days later. I believe she's been sick with COVID since before Christmas, but only now got tested. Will the vaccine even work for her since she's sick? It's like she never got the first shot. Well, the vaccine will help. Yeah, it'll help make sure you have immunity after having, if you got COVID roughly at the same time. So it's not all for naught, and you should get the second shot still 21 days later. One thing we've been noticing that if you've had COVID and when you get a shot of the vaccine after that, the soreness is a little bit worse, and there may be a little bit higher chance you'll get a fever. So take some Motrin or Tylenol afterwards for those annoying symptoms. But yeah, it'll help. It'll help immunity occur. So it's unfortunate, but the one thing I will say, you cannot get COVID from the shot. So if you get the shot and 2 days later you test positive for COVID, it did not come from the shot. It came from some other exposure you've had. So that's important to remember. Patty asks, once we receive 2 shots, can we still get COVID? Will we still have to wear a mask? What will it take to feel safe from getting COVID? Well, you can feel safer after having your shots, but you're still going to need a mask. You're still going to need the distance for all the reasons we talked about. And the other thing I didn't mention is that, if you decide, okay, I feel good enough, haven't had 2 shots, I'm not going to mask, and then you go out to the big box superstore, the people around you don't know you've been vaccinated. And you might be making them uncomfortable. And it's definitely not polite. So stay masked, stay distanced. How long will we need to be doing that? That's the million-dollar question. I suspect once we get into the fall that we'll be able to start backing off some. It may be we'll be backing off on the distancing first and staying masked. I don't know exactly how that's going to look yet, but we'll see how that goes. So a lot of good questions today, and I think since vaccination is still so new and such a moving target, how the ages are going to change and priorities, we'll go ahead and have people submit questions for next week too, if that's okay with everyone. So, any questions from you guys back here?
Sorry, apologies for coming in late, but with this now being exactly 2 weeks out from New Year's, and there's some gatherings around that time, I'm assuming we're expecting some spikes even with the vaccination rollout.
Yeah, so the question is with New Year's and the holidays, we're expecting some spikes. Yeah, I think we're in that now, actually. I know also talking to the docs taking care of the COVID patients in the hospital, that a lot of them exposure was over the holiday period. So I think particularly for hospitalizations, we're seeing that now. People got it over the holiday. It's those bubble fusions, getting together with family and friends who are from other household units. It's still the main risk. Still the main risk where people get it. All right. Sorry.
I've got one question, asking if you could talk about the bipolar ionization technology, school system installed.
Yeah, so the question is what's the school system installed bipolar ionization technology? What does that do? Well, it kills virus that would be in the environment, and particularly on surfaces and such. In the laboratory, it works. It's not really been assessed in large outlays like that, but certainly not going to hurt anybody. It's totally safe. I mean, it's just some people have those little ion generators in their rooms, in their houses. You can buy them on Sharper Image, I think. Not that I'm endorsing that. Do you have a question, Eric?
Yeah.
Yep.
You kind of touched on it about the big vaccination thing. Some people's talking about maybe you talk a little bit more about when you think they'll be here.
Yeah, I think for Forsyth County here, I think that they'll be sometime in the first 2 weeks of February would be our first one here. It's still a little bit in the planning stages and putting all the logistics together. But it would, when we talk in mass, so when you do these mass vaccination events, so there's kind of 2 ways to do it. One is in a car, one is out of the car, and there's advantages and disadvantages of doing it both ways. This time of year, weather can be a wild card a little bit. Sometimes you could do it indoors. If you do it indoors, then you have to make sure that social distancing is done. So there's probably hybrids where you come in and then you wait in your car and then your cell phone goes off and and that knows it's time to come in, something along those lines. So the details are all still being worked out, but I guarantee you we'll see one. We'll see one, probably more than one up here.
I know somebody texted me about it. They said that they've been hearing it probably over the fairgrounds.
Most likely, yeah. The for here in Winston-Salem, the fairgrounds would be a good place to have it. Now I'm not guaranteeing that's where it'd be because there's a lot of logistics about it. But you want a place where there's a lot of parking, right? You want a big building or a big place to do it. You have to have things like power and electricity and Wi-Fi for informatics, for uploading and registering and uploading the vaccine data. You have to have places where people can spread out because you don't want a super spreader event at your vaccine event. That's bad form. And you want it on a bus route so people can get there who don't have car transportation. You want it close to marginalized populations and where people know where it is. So if they're driving in from, Wilkes County, they can get in and do it. So, I mean, here in Forsyth County, it would make a lot of sense to do it there.
One more quick question about talking about getting the next shot, the booster shot. I don't know if I've ever heard you say there's nothing different about the second shot. It's the same vibes. It's not like a stronger version or.
No, that's a good point.
Same.
Yeah. So the booster shot for COVID, the one that you either get at day 21 if it's Pfizer's vaccine or day 28 if it's Moderna's, it's the exact dose. It's the same amount of vaccine material and the same aliquot, same needle, same syringe. Well, it's not the same as you had before, but the same kind. And so there's nothing different about it at all. It's just another just 1 second shot, that's all. All right, see you next week.